Hello friends, my name is Simran Gupta and I am pursuing my study in To'omahi Institute of Technology, Rotorua campus. I am a student of Infection Risk Management Level 7 and I am going to give a presentation on my subject which is Fundamentals of Infection Risk Management 7003. Now, my presentation is based on a topic of health-acquired infection, which means HAI infections, which are also known as nosocomial infections. Nosocomial infection comes under the infection control. Now, I am going to introduce my topic, which is infection control. Infection control. Infection control is a vital issue that ensures safety for the staff, children's, women's, men's who are working in any clinical areas or clinical health sectors. It even assures of complete protection to the patients from the risk of cross-infection, which are very simple or which are very easily infected from one person to another. It is for this reason any medical institute or organization follows a definite set of guidelines to prevent infection. These guidelines are developed for the organization as per the standard set by the CDC Government of New Zealand or of any nation. In this case, we have take To'omahi taken as a reference to the study of mechanisms followed in clinic areas for both control and prevention of HAI infection, that means hospital-acquired infections, prevalent in New Zealand. As a fact, this whole presentation will focus on presenting a detail of several scholarly pieces of evidence to present an overall understanding of the issue of hospital-acquired infection in any healthcare setting present in New Zealand. Now, I am going to give some examples, some identifications on some of the common microorganisms which are responsible for the hospital-acquired infection. The first example of this infection is LRTI. But to explain this example, I would like to explain something that was from the several studies it have been conducted which presented alarming details of commonly evident infectious diseases among patients, persons and staffs of acquired from the environment who lives in the hospitals. Recent studies have revealed that the commonly caused infections were related to the LRTI infections, which means the infection of the lower tract of respiratory. Some infections are from the urinary tract infection, some infections are influenza-like, some are gastrointestinal infections, and now I am going to present some diseases which these diseases caused by some microorganisms. First, I take an example of LRTI, lower respiratory tract infection. It is caused by Mycoplasma, pneumonia, Chlamydia species, Legionella. Second example is UTI infection, which is urinary tract infection. Urinary tract infection caused by an organism Staphylococcus or E. coli. Now, ILI infection, which means influenza-like infection. Influenza-like infection is not more common, but it is a seasonal influenza. It's caused by influenza A, influenza B, or IAV, and we can also call it IBV viruses. Now, GI infections, which means gastrointestinal infection. These infections are caused by Escherichia, Giardia, E. coli, Shigella, C. difficile, and it is most commonly disease of water. Now I am talking about SSTI infection, which means soft skin tissue infection. It is caused by the gram-positive and a gram-negative bacteria. Now I am going to figure out some graphical representation. As you see, this graphical representation in New Zealand, it is the graphical representation of whole To'omahi institutes in all over the New Zealand. As per above the geographical representation of the trends of acquired infection in the chemotherapy department of Toomai of New Zealand, it is found that the infections of lower respiratory tract has the maximum prevalence rates, which are equivalent to 51%. This is followed by the prevalence rate of UTI infections, and 22% of patients and are from UTI infections, 80% of patients are from cellulitis, and 0 to 5% of patients are from influenza-like infection. You can clearly see on this graph 51% is of LRGI, and 18% of UTI, 0 to 5% is of ILI. If I talk about the New Zealand, the whole New Zealand around 10% then suffers from HAI, that means hospital acquired infections or the infections which are acquired in hospitals. Now I am going to evaluate the impact rate of hospital acquired infection in patients, facility and the staffs. As we are talking about the treatment of the hospital acquired infection is relatively somewhat costly for the facilities of the healthcare to bear. It affects the financial status or crisis of the organization of any person. Often the infections are not diagnosed at a time, which is a clear indication of the negligence of the facilities. It is for this reason the mortality rates is high due to the hospital acquired infections in New Zealand are not increasing in the facilities. This suggests that even if such situations require clear awareness of the clinicians, the existing guidelines for the antibiotic therapies are not effective enough. On the controversy, it is popularly believed that the increasing incidence of hospital-acquired infections among patients is maximum in number, and the negatively impact is the goodwill of a facility. The occurrence of hospital-acquired infections is a greatly effect in the lives of the patients. The patients are affected by financial crisis due to loss of employability, which is a direct implication of a prolonged period of illness. This is because the patients get admitted to the hospital for treating for one disease but affected by another owing to the unhygienic condition in the hospitals. Thus, on the whole, it degrades the quality of their lives. Moreover, considering the clinical aspects of the impact of hospital-acquired infections, it is found that the higher rates of risk are evident in the elderly or adult patients. For example, in the case of bloodstream infections, the cost of treatment is comparatively high in any city-based hospitals or care centers in New Zealand, like that of Toomai. However, in most cases, the researches which have revealed such results have excluded the patients who have been admitted to the hospitals within minimum time span of 24 hours. This might have actually underestimated the real figures, which prove how grave the situation has turned out to be. Similarly, as per one writer, when the hospital environment is hygienic and lacks of maintenance of the specific guidelines for the sterilization, then the staff seem vulnerable to such situations as well. Apart from this, occupational exposures led them to risk of acquiring the infections. This results in staff transmitting the diseases. Thus, it is found in maximum cases the hospital staffs turn out to be the carriers of the infectious diseases because all of them are treating their patients with the bare hands. They doesn't wear any gloves, any sterilization. That's why, on the whole, it can be asserted that the hospital acquired infection result in increasing number of people in crowding hospitals, crowding places, frequent occurrence of the impaired immunity among patients as well as the staff. The most significant factor is that it leads to increased potential of a bacterial resistance to the antibiotics. Now, I am going to review of origin in the key of infection and its control practice by discussing its importance in the current practice and some specific guidelines in relation to the hospital acquired infections. In order to understand the ways to stop the occurrence of hospital-acquired infections, it is equally important to identify the origin of such key infections like lower respiratory tract infections. A not cause of such infections is identified at the right time, then it can result in increased expenditures of extended levels of health costs, bigger hospitals or healthcare clinics like that to OMI tend to have greater risk where treatments for patients with acute illness are carried out, like that of cancer or kidney or diseases. You can see their impact on this picture which is given below. The complex system or the complex procedures which are carried out by the hospitals that put patients at higher risk rates of hospital-acquired infections. To the widespread prescription of antibiotics, it leads to the growth of microorganisms which may be resistant to more than type of antibiotics which are used now. There are so many number of infections which are also caused by an organisms present or the body of the patients. Moreover, the infections which are occur when the disease causing microorganisms can invade susceptible hosts. Thus, the potential sources of infections are that of infected staff or patients, areas which are very moist and unclean environment within the hospital, dry objects and the surfaces which have been recently contaminated, endoscopes or the medical devices, people who are carriers of the microorganisms which are recently contaminated, endoscopes or the medical devices, people who are the carriers of the microorganisms, environment within the hospital which are exposed to fungal spores or from building materials or sites. You can see there is a risk of a person who are taking the antibiotics then he admitted in the hospital, their strains get resistant and they also get infected through the faces or hand-to-hand hygiene, and this is called the high risk of infection in all the environments. Now, I am going to talk about some evidences of the infection guidelines of New Zealand and some other international guidelines for the prevention and the control of infection from the mentioned microorganisms. As per the reports presented by the Office of the Auditor General as well as Controller, a well-defined management guideline is provided for managing the process of control and prevention of hospital-acquired infections in the public hospitals. The body is continuously engaged in mitigating the issues of hospital-acquired infection in hospital. As per the Health and the Disability Act of 2001, the healthcare organizations are required to offer services to patients as per the control standards of infection. According to CDC or the Health Ministry of the New Zealand has been scouring a nation while surveillance system for investigating the infection acquired in hospitals. Moreover, the Ministry of Health has specifically stressed on mitigating the risk of and the risk of infection which are associated with the bloodstream related infection. You can see in this chart the bloodstream infections. These are collated with each other and globally served. Laws are implemented to mitigate the risks associated with the hospital-acquired infections. For instance, the laws are applied both at the state as well as in the national level in the USA and in the New Zealand too. The Federal Department from Healthcare Services in the US implemented an action plan to reduce the hospital-acquired infections. Similarly, the World Health Organization or the WHO who provides a detailed guidelines for the prevention of these kinds of infection and suggests the implementing to use these guidelines by the public. And these are one of the best cardinal principles and guidelines which are used by every hospital and every healthcare center around the world. Now I'm going to conclude my whole topic with some conclusion. be concluded that the infections which are acquired are immediate measures need the hospital infections needs immediate measures to adopted by the hospitals to prevent it and control it in the first place. This is because an occurrence of hospital acquired infections have deep impact on the patient's facility as well as the staff. Hospitals need to follow standardized guidelines provided by the Health Ministry of New Zealand to acknowledge such measures. Moreover, we need to have a hand hygiene and environment of the hospital will help to reduce the prevalence of these infections. Thank you.